Hello, my name is Marcos Borges, and today I'm going to talk about preserving renal allograft function and the PD-1 pathway inhibitor Nivolumab. Definition: immunotherapy is the use of drugs to boost a person's immune system so that it recognizes and kills cancer cells more effectively. Several types of immunotherapy can be used to treat kidney cancer.
The role of the immune system is to protect the body from foreign invaders. Normally, the immune system responds to tumor cells as it does to any foreign invader, by destroying them. T cells play a central role in this immune response to cancer. T cells are primed and activated by dendritic cells within the lymph nodes. They can then infiltrate the tumor microenvironment, which is comprised of tumor cells and other tumor-infiltrating immune cells. Here, the activated T cells detect, bind to, and kill tumor cells. Programmed death ligand 1, or PDL1, is one of the inhibitory ligands that, under normal conditions, help maintain immune homeostasis. However, in many cancers, PDL1 can help tumor cells evade the immune system, particularly when it is expressed in abundance. This occurs when activated T cells release interferon gamma, leading to overexpression of PDL1 on both tumor-infiltrating immune cells and tumor cells. PDL1 interferes with the body's anti-cancer immune response by binding to its receptors, B7-1 and PD-1, on the surface of activated T cells, thereby deactivating the T cell's cytotoxic activity. T cells can also become deactivated when PDL1 expressed on tumor-infiltrating immune cells binds to B7-1 or PD-1.
Applications in medicine: inhibition of immune checkpoint with the use of antibodies targeting programmed cells DID1, PD1, or monoclonal antibodies against cytotoxic T lymphocyte-associated antigen 4 has been used clinically in patients with various types of cancer. Pros and cons. Side effects of PD-1 inhibitor can include tiredness, cough, nausea, itching, skin rash, loss of appetite, constipation, joint pain, and diarrhea.
Last year at ASCO was hugely exciting because we saw the first presentations of the anti-PD-1 and anti-PDL1 drugs as monotherapy, but of course that's now moving to combination, doublet, and even triplet strategies. So we're not just talking about chemotherapy and immunotherapy or immunotherapy alone, we're actually talking about immunotherapy and immunotherapy. So the two presentations I've just been to, which involved a mad rush across the conference centre because they're almost at the same time, were Bristol Myers Squibb's study of Nivolumab and Ipilimumab in small cell lung cancer in really a fair number of patients. That's 220 patients where there's no recognised second-line treatment option. And to my surprise, it was really quite well tolerated, which I thought was an unexpected finding. And there were two other points, which was that the response rate were reasonable and the responses seemed durable. So they're now going to put that combination into phase 3 studies. So small cell lung cancer is, a horrible disease. People are very congratulatory at first because it's chemosensitive, but then we know it recurs with what I can only describe as a wrath. And this provides a totally new, different way of treating it. And then I went to Roche's presentation of their OX40 agonist and atezolizumab, their anti-PD-L1. So that's really on the subject of trying to make cold tumours hot, trying to make unimmunogenic tumours responsive to immunotherapy. So you have an agonist, an immune stimulant, and the PD-L1, which inhibits the inhibition. And together, and again, we saw some durable responses across a range of tumour types. So again, we're talking about some very impressive developments where perhaps we don't need chemotherapy in 20 to 30 years' time, and we'll be just talking about immunotherapy combinations.
Issue applied in Ecuador. Nivolumab are drugs that attack PD-1, a protein in cells of the immune system called T cells that normally help prevent these cells from attacking other cells in the body. By blocking PD-1, these drugs boost the immune response against cancer cells.
So there's been a lot going on in kidney cancer. As I mentioned, it was one of the diseases that was featured, if you will, in the phase 1 study. There was over 30 patients in that phase 1 study. That was the initial signal that these drugs had, pretty clear activity. So since that time, there have been, a number of studies done. We've participated at Cleveland Clinic in many of them. Again, BMS has had the lead compounds. They've done studies of their PD-1 inhibitor plus either pazopanib or sunitinib. Be some data presented, I believe, Monday on that combination. Then they've also done Ipilimumab, which is a CTLA-4 inhibitor, another checkpoint inhibitor, plus nivolumab, again, based on some signal seen in melanoma. They've launched a phase 3 trial compared to everolimus in the refractory setting. So there's a number of trials going on. Our experience in treating patients either with single agent or with combination is that there's clear anti-tumor activity. Impressively, some of it's very durable. It's a little earlier on in kidney cancer than, say, melanoma, but we're starting to see patients out now over a year, probably some approaching 2 years from the early trials, which is an impressive duration of disease control. And I think the other important thing we've seen is toxicity. So the downside we haven't talked about yet is that these drugs kick up the immune system against the tumor. That's good, but they also kick it up against normal organs. So against the bowel causing diarrhea, against the liver sometimes causing liver function abnormalities, etc. So we're kind of getting another education in toxicity management that's very distinct from TKI management. That's some of the same side effects like diarrhea, but very different in terms of management, using steroids and other anti-inflammatories to control. And it's been a whole nother learning curve for us. And I think that's going to be a challenge as these drugs roll out, into broader clinical trials and into the community eventually. Is sort of re-educating people, because prompt recognition of and treatment of side effects is critical, I think, for successfully balancing risk and benefit for these drugs.
Conclusion. Immunotherapy is the use of drugs to stimulate a person's immune system to recognize and kill cancer cells more effectively. Nivolumab are drugs that attack PD-1, a protein in cells of the immune system called T cells that normally help prevent the cell from attacking other cells in the body. Thank you very much.